This is a presentation on generalized anxiety disorder and panic disorder. Generalized anxiety disorder is a psychological disorder characterized by persistent, excessive, and unrealistic worrying about everyday things.
Panic disorder is a psychiatric disorder in which debilitating anxiety and fear arise frequently and without reasonable cause. Panic disorder can be characterized by frequent, unexpected panic attacks. The background of general anxiety disorder and panic disorder begins in 1895, where Freud defined anxiety neurosis as something separate from other mental disorders. And then in 1980, a major change occurred in the diagnostics of anxiety disorders. The American Psychiatric Association changed the classification of anxiety disorders. The APA separated anxiety neurosis into two categories. The first, panic disorder, was characterized by spontaneous episodes of intense anxiety. The second category, which is general anxiety disorder, can be characterized by chronic sustained activity without panic attacks. In 1962, research was done by Klein on anxiety disorder neurosis, and he eventually began researching the two categories separately after the APA split anxiety neurosis into panic disorder and general anxiety disorder.
Okay, the causes of general anxiety disorder and panic disorder are still a little bit unclear and debated. Psychologists have linked these disorders to abnormalities in the portion of the brain called the amygdala, which helps regulate fear and aggression. It is believed that panic disorder is caused by an abnormality in the amygdala that affects the fight or flight response, resulting in intense panic attacks in response to stress. Psychologists are currently doing more research to explain the brain chemistry that causes these disorders. It is also believed that general anxiety disorder and panic disorder are genetic disorders and are hereditary, or are caused by certain personality risk factors, such as a natural tendency to worry or easily become stressed. Another theory is that anxiety disorder is caused by negative life events or constant stress. A traumatic experience or extended periods of stress can often induce an anxiety disorder. Some environmental factors that are linked to anxiety disorders are separation during childhood, role inversion during childhood, lack of social interactions, poor life satisfaction, a modeling of a relative having an anxiety disorder, and substance abuse is also linked to panic disorder and general anxiety disorder.
Generalized anxiety disorder and panic disorder have a lot of the same symptoms, such as anxiety, difficulty concentrating, difficulty breathing, difficulty with sleeping and staying asleep once they do fall asleep. A lot of times they'll wake up in the middle of the night feeling worried about their upcoming day or just factors that they shouldn't be worried about. They're tired a lot, they have headaches, they're dizzy, they have intense feelings of dread, pounding heart, sensation of choking, dizziness, sweating, trembling. They're nauseous a lot of times. They get chills or hot flashes, and they have a fear that you are losing control or are about to die.
Okay, the diagnostic criteria for general anxiety disorder includes excessive anxiety or worry that lasts about several events or activities for most days of the week for at least 6 months. You must have at least 3 of the following symptoms in adults and 1 of the following in children: either restlessness, fatigue, trouble concentrating, irritability, muscle tension, or sleep problems. Anxiety or worry that causes you significant distress or interferes with your daily life, and this anxiety cannot be related to another mental health condition such as panic attacks or PTSD, substance abuse, or a medical condition.
And then we have our example on the bottom of generalized anxiety disorder.
The diagnostic criteria for panic disorder is recurrent panic attacks that must be associated with longer than 1 month of subsequent persistent worry about either having another panic attack or the consequences of the attack, or else the significant maladaptive behavioral changes related to the attack. These recurrent panic attacks must be characterized by at least 4 of the 13 symptoms that of a panic attack, including the fear of dying or losing control, feeling dizzy, lightheaded, shortness of breath or feeling like you're choking, sweating, chills or hot flashes, abdominal pain or nausea, trembling, shaking, or hot flashes. And some of these symptoms can be, all of these symptoms actually can be seen on this diagram. And you must have at least 4 of those for it to be diagnosed as a panic attack. We also have another example of what it's like to have a panic attack and the effects of that. This is on the bottom. The more attacks I had, the more afraid I got. I was always living in fear and didn't know when I might have another attack. I became so afraid that I didn't want to leave my house. This quote kind of captures what it's when a disorder is diagnosed as panic disorder, when the anxiety about the attacks or the attacks become so severe that it affects the ability for daily activities. General anxiety disorder affects about 3.8% of the American population, or about 4 million American adults. It is twice as common in men as it is in women, and the average onset of general anxiety disorder is about 14 years of age. The risk level is highest between ages 18 and 34. As you can see on the graph, anxiety is more common among adults than among children. Anxiety affects about 2% of those between the ages 15 and 25, compared with about 7% of those above the age of 45. Similarly, panic disorder affects 2% of American adults, or about 2.4 million. It's slightly less than general anxiety disorder, but similarly, it affects twice as many women than men. And it also develops during the late adolescence or early adulthood. Panic disorder is much more common in adults than children, even more so than general anxiety disorder. Children under the age of 14 are rarely diagnosed with panic disorder, but rather suffer from more milder anxiety problems, such as separation anxiety or other just worry and fears. But these can later develop into panic disorder. Less than 1% of children under the age of 14 are affected by panic disorder, compared to the 2 to 3% of adults who are diagnosed.
General anxiety disorder and panic disorder have a lot of the same treatment plans. So one of which is psychotherapy. And psychotherapy is a type of counseling which addresses the emotional response to mental illness. It's a process in which trained mental health professionals help people by talking through strategies for understanding and dealing with their disorder. A common type of psychotherapy used for treatment is cognitive behavioral therapy, and this helps a person learn to recognize and change thought patterns and behaviors that lead to troublesome feelings. This therapy aims to identify possible triggers for panic attacks. This type of therapy also teaches a person different ways of thinking, behaving, and reacting to situations that help him or her feel less anxious and worried. Medication can also be used. There's 2 different kinds: anti-anxiety medication and antidepressants. And then the third method of treatment is meditation, which is usually just used for panic disorder.
Here are our sources. That concludes our presentation. Thank you very much for listening.